On this podcast, we're going to be covering common mistakes you may be making with your skin that could be ruining your skin. And these are mistakes that so many of us make every day, and maybe we don't realize how bad it actually is for our skin and our overall facial aging and aging of our bodies. So let's talk about these common skincare mistakes that you must avoid. We all have our own skincare regimen. Sometimes it's very simple. Sometimes it's quite extended and advanced and complicated. But it's really important, I think, to make sure that you don't make some of these mistakes, because if you're doing everything right, but you do some of these wrong, it can really, really cause major issues in your skin. So the first one is exfoliating too much. How often should you exfoliate? It's a good question. There's some people who think they should exfoliate every day, and there's some people who don't exfoliate at all. Well, exfoliation basically is the act of removing the upper layer of skin cells. And by doing that, it sends a cellular signal to the deeper layer of skin cells to turn over more quickly. When we're younger, our skin turns over every about 6 to 8 weeks or so. And as we get older, that process slows down and we start getting clumping of skin at the surface of like dead skin cells. And that is one reason why the skin feels and looks rougher in texture as we get older. And so exfoliating your skin can create that wonderful soft feeling of the skin right afterwards. And once again, as a short-term benefit, you get that nice smoothing of the skin texture and all of that. But long-term, once again, it can send these cellular signals to basically ramp up that process of skin cell turnover. And that causes the skin to look and feel younger. So exfoliation in general is a really good thing.
Yes!
But
No!
too much of a good thing could be a bad thing. So in general, I recommend if you've got sensitive skin, you really only need to exfoliate maybe once a week. That's it. If you've got quote unquote normal skin, then 2 times a week, maybe up to 3 is all you need. And there are a lot of different ways to exfoliate. Some people will use chemical exfoliation with like at-home chemical peels and those types of things. Other people will use a physical gentle scrub. We have one in my skincare line, Youn Beauty, our advanced exfoliating cream, which I think is great. But it is a physical, basically scrub, a very gentle one, but you can feel kind of those particles as it kind of smooths the surface of the skin by a very light abrasion. So how do you know then if you're exfoliating too much? You may be exfoliating 3 times a week, but how do you know that that's too much for you? And the way to tell basically is how your skin looks and feels. If your skin is kind of red and inflamed, if it's irritated, then it's possible that you're exfoliating too much and decrease the amount of exfoliation that you do. However, if that's not describing your skin and your skin is very comfortable, and you're following kind of this once a week with sensitive, 2 to 3 times a week with normal skin, then you probably are doing just right. So really the way to know is to just see how your skin is tolerating it. If it's red, inflamed, irritated, then one of the first things you want to do is reduce the amount of exfoliation that you do, because you can over-exfoliate. Okay, so the second common skincare mistake to avoid is to use hydroquinone for longer than 6 months. So hydroquinone is an ingredient in skincare products that is probably the most powerful brightening or lightening agent. Hydroquinone has been around for decades. If you ever heard of the skincare brand Obagi was one of the first big skincare lines that had a protocol using 4% prescription strength hydroquinone. And I learned about it when I was a resident back in 2002, 2003. So this has been around for a long time. And it's a very powerful way. If you combine 4% hydroquinone with prescription strength retin-A or tretinoin, and then you add things like exfoliating agents like alpha hydroxy acids, you can create some radical changes in the sun damage of people's skin. I mean, the amount of change you can get if you get a person on the original Obagi or now Zeo Skin Health formulas, those protocols are super, super effective. And I've had patients on these protocols with 4% hydroquinone, ever since I started my practice 20 years ago. But hydroquinone is not the perfect skincare ingredient because there are potential toxicities involved. If you are pregnant or nursing, do not use hydroquinone. And we know that hydroquinone in people who have very dark skin may create a condition called ochronosis, where you are now putting a lightener on your skin, but it actually causes your pigment to go haywire and make your skin darker. Okay, now that only happens in people who are darker skinned. If you're really from the continent of Africa or your ancestors are, they're really the only ones I know of that have actually had this condition. So if you've got Caucasian, if you're Asian, if you're, Latino, then that's not going to likely affect you. But if you have darker skin, like I said, if your ancestors are from the continent of Africa, then that is potentially something that you want to be concerned about. Also, we have learned over the past 20 years that hydroquinone can create rebound hyperpigmentation. And what that means is that if you are on it for a long period of time and you go off of it cold turkey, even though your skin was lightened with the treatment, if you go off it, you may find patches of pigment come back. And they may come back with a vengeance. And so I do recommend hydroquinone for only 6 months at a time so that your skin doesn't get too used to it, because if that's the case, then you may find that going off of it can be very difficult. So all of this means really, if you're going to do hydroquinone, make sure you have it done. It is prescription strength. It's only available in the United States as a 4% prescription strength. And so you have to get that through a doctor's office. If you do, don't just go with any doctor. You really want to make sure it's a dermatologist or a plastic surgeon, or in their offices by one of their estheticians, so that you know that you can be followed up and you know that they're watching over you fairly closely. There used to be 2% hydroquinone here in the United States, but that actually has been taken off the market. Interestingly enough, it was part of one of the COVID relief acts where they just threw that in in one of the bills that was giving COVID relief. And they say, well, while we're there, let's get rid of 2% hydroquinone. And so they did. Okay, well, that's the story of hydroquinone. My third common skincare mistake is treating inflamed or irritated skin by adding more products. So what do I mean by that? I get so many people talk to me, or they DM me, or they put comments on my social media posts that they have skin that is irritated, it's inflamed, it's breaking out. It's got multiple issues. And they ask, what cream can I add to my regimen to make my irritation go away, or to make my breakout stop, or to reduce my inflammation? And often the answer is not what to add to it, but what to take away from it. And so this is what I often will ask people. If you say, yeah, my skin's just irritated, it's inflamed, I don't like how it looks, I'm an adult and I'm breaking out. First thing I would ask you is, what are you putting on your skin? What is your skincare regimen? And if you have like a 7-step skincare regimen, then it's possible, especially if you're using products that are not considered quote unquote clean beauty, that all of those additives and preservatives and fragrances can be causing your skin to become more irritated than if you didn't use them at all. And so in these situations, instead of adding a new product to your regimen to try to tamp down the inflammation or the irritation or the breakouts, I recommend you get back to the basics. Get back to cleansing in the morning, apply an antioxidant serum, and then a sunscreen. And that's it. In the evening, get back to cleansing and a moisturizer, and maybe a light type of anti-aging cream, or maybe just avoiding that for a while. I'm just really limiting what you use on your skin, because oftentimes you're doing too much, and doing too much is actually ruining your skin. So getting back to the basics, if that describes you, and seeing how your skin does, oftentimes is much better. I see something like this with my patients as well. As you know, I perform a lot of cosmetic surgery, and we have a complete supplement system that I give to my patients. And I firmly believe that taking certain nutritional supplements before and after surgery can help you heal faster, lower your risk potentially of complications, reduce inflammation, and hopefully have you on that other side quicker than you otherwise would be of healed and happy with your results. But there's a small percentage of people that call me after surgery and they say, oh, I've got diarrhea, or I've got an upset stomach. And I'll tell them, look, first thing you want to do is let's get you off those supplements, because you never know if you may be reacting to them. And so getting off of that, because in the end, kind of getting back to kind of your body just being natural sometimes is better for some people. And so that works with skincare as well. Another common skincare mistake that you must avoid is not using sunscreen or sunblock. Now, as you know, I've got a lot of friends in the alternative medicine space. I've done interviews on podcasts where we've really gone back and forth on the whole sunblock issue. I have friends of mine who don't use sunblock, who believe that it's because you're eating too many seed oils, that's why you get skin cancer and things. And I think that we have to look at all this as a multifactorial thing. And unfortunately, there's some people who look at sun protection, and all they think about is sunblock. But they don't think about having also a healthy lifestyle on top of that. They just think, hey, just cover your skin or wear sunblock and you're fine. But they don't think about the dietary things that can cause inflammation in your skin and your body that can lead to potential skin cancer. They don't think about, let's say, all the chemicals in certain skincare products and layering those products one on top of another and their fragrances and all of the negative ramifications that can have on your skin. But then there's the other group of my friends who are on the opposite side, and they say, you know what, I don't wear sunblock because our skin is naturally supposed to tolerate sun. Sun is good for your skin. And I do agree it is good for your skin in small doses. We need to get that vitamin D synthesis. But their belief in some cases is that it's your lifestyle that's doing it. And if you lead a healthy enough lifestyle, you can spend all day in the sun and not get burned, and you won't get skin cancer because you're avoiding seed oils and you're eating healthy sources of protein and fruits and vegetables and all of that. And I think really the reality of it is all of that. It's that if you combine, the worst case scenario is you have a poor lifestyle and, you're eating all these inflammatory foods and you're not wearing sun protection, you're going out in the sun, then yes, you are a complete setup for skin cancer. And God knows we don't want to get that. But at the same time, I really think that the best course of action is to combine both, is to reduce the amount of seed oils, eat healthy sources of protein, eat a lot of fruits and vegetables, get those antioxidants in, and to use sunblock, especially when you're out. And I firmly believe that. I'm also one that would encourage you to avoid certain chemical sunscreens like oxybenzone and octinoxate. The jury is still out. Are they truly as harmful as some people believe? We don't know, but there's a possibility that they could be endocrine disruptors. There are other good UV filters out there. I strongly encourage you, we've got a couple at my online store from La Roche-Posay. You can get La Roche-Posay and Helio sunblock. You don't have to get it at my store. You can if you want to support me, but also you can get it at some of your local drugstores. You can get it online through La Roche-Posay as well. I'm also a huge fan of Korean sunscreens. I can't legally sell them here in the United States. I wish I could, but I can't because of kind of import issues. But you can actually still get them. They will be actually shipped from Korea to you through various companies. So if you want to try some new types of sunscreens, I strongly encourage you to try those. If you don't like some of the thicker sunscreens that we have here in the US, then the ones in Korea, some of them are just great. So definitely use your sunscreen, use your sunblock. If you don't like them, try the ones that we have on my website. Some of them are really good. La Roche-Posay, really thin, feel good on your skin, or get some through Korea. Those also are good ones. Another common skincare mistake to avoid, and I tell you, if you follow me, I do a good amount of TV, and I've done the Rachel Ray show a bunch of times. Lately, I've been a regular on Live with Kelly and Mark, which has been a lot of fun. And I get a lot of makeup put on me for these shows. Not a lot, but I get makeup put on oftentimes when we do these programs. It's just kind of their thing. They do that on everybody. They do your makeup, they do your hair. And then usually after they put my makeup on, they give me a makeup wipe to wipe it off afterwards. And I tell you, I always give it right back. A couple reasons why. Number one, makeup wipes don't really clean the makeup off your face. A lot of doctors, dermatologists believe, and makeup artists even believe that it just more smudges it around your face. So it doesn't wipe it off as much as it kind of smudges it. And then another reason why a lot of people don't like them is that they're not environmentally not environmentally conscious, I guess, because you do get a lot of waste every time you use that. And then a big reason why I don't use them is because whenever I have, my skin gets really irritated by them. And I don't know if it's the scent in it or what's in it, but I get itchy and I get redness from it. So I don't like using them at all. So instead of using makeup wipes, what I recommend would be to either use micellar water or an oil cleanser. Micellar water is, if you want to use something very light on your skin, that's great for taking off makeup. Oil cleansers are really good for taking off makeup as well. If you've got oily skin, then actually oil cleansers work even better because they can really get into those pores and can clean everything out. So instead of using makeup wipes, if you've been using makeup wipes all your life, I strongly encourage you, try a micellar water. They're very inexpensive. You can get those at your local Target or your drugstore, or try an oil cleanser if you want something that's a little more of an elegant solution.
Very demure, very mindful.
We have one at my online store, Youn Beauty. We have our makeup removing oil cleanser. I think it's fantastic. A lot of people really like it. So just try those. I think you might, one of those, you might find that you like that much better than makeup wipes. Okay, we're almost done with the skincare mistakes you must avoid. I've got 2 left for you. The second to last one is kind of a no-brainer if you are a skincare enthusiast, but I guess I still have to say it, is using bar soap on your face. Now, there are certain facial cleansers that are made as a bar. Those are not what I'm referring to. I'm referring to like regular bar soap, like a bar of Dial or Irish Spring or any of these other kind of commercially available soaps. They have surfactants in them that can leave a film on your skin that can cause your skin to dry out. These are made for the body. They're not made for the sensitive skin of your face. So I really discourage you from using bar soap. So many of my followers, I think about 70, 80% of my followers are women, which means 20 to 30% are men. And if you are a male listening to this podcast or watching today, I appreciate you being part of my community. But if you are a woman, and oftentimes I hear this from my followers and my patients, is that you say, well, geez, my husband or my boyfriend, all he does is use bar soap on his skin and then doesn't even put a moisturizer or a sunscreen and he leaves. That's it. He just uses bar soap. And I tell you, earlier in my life, I was, in that mentality as well. But if you've got a spouse or a significant other who's doing that, simple thing is just get them a facial cleanser. Just buy that for them. You can get them inexpensive. The one that we have, Youn Beauty, our green tea cleanser, it's like, I think it's 6 or 8 ounces. It's big. It's not that expensive for what you get. It can last like 4 to 6 months minimum for some people. Just buy something like that. You don't have to buy mine. You can get one from Cetaphil if you'd like. That's a lot less expensive, but just use that, put that next to the sink and ask your significant other to use that instead of bar soap. That's a simple first step into skincare. And hopefully it will encourage your significant other to take more steps after that. But yeah, using bar soap, not good. Okay, so another skincare mistake you must avoid, my final one on this podcast, is waiting to apply your moisturizer too long after you get out of the shower. So this is really important. If you shower, you're obviously showering with water, and as you get out, you dry off. It's really important within 2 minutes to apply your moisturizer. That's going to lock in that moisture and make that moisturizer work so much better over the next 24 hours or so. If you wait for your skin to dry out and then you apply the moisturizer 10 minutes later, now there's not much moisture to lock in. And now you're not going to get the same type of a result. So especially if you're in like the dry climates, if you live in the Southwest of the United States, or if you're in the northern climates and it's middle of the winter and it's cold and so dry, then it's a simple thing is to lock that moisture in within 2 minutes of exiting the shower. You will be happy that you did that. So these are some common skincare mistakes that you must avoid. If I have missed any, I would love to hear your suggestions. Just leave a comment on any of my social media posts, throw me a DM, any of that stuff. Would love to hear if I've missed some, and I'll try to maybe add that to a future podcast. And if you've been enjoying this podcast, as always, if you could take 2 minutes of your time to leave a rating or review, it definitely helps me spread the word. But as always, this is Dr. Anthony Youn. This is the Dr. Youn Show. Remember to always eat real food, use clean skincare, and auto-rejuvenate before you operate.